Well, currently, nearly 1 out of every 5 Oklahomans does not have health insurance. A recent study shows that coverage gap is not only costly, but often deadly. According to the American Cancer Society, uninsured Americans diagnosed with cancer are more than twice as likely to die within 5 years than those with coverage. Not because of a lack of treatment, but because they're less likely to discover the cancer early on during routine screening tests. Bridging such a gap between the haves and have-nots is what's behind a new effort to insure more Oklahomans. Our Brian Bindley has all the details.
An estimated 700,000 people are without health insurance in the state of Oklahoma. A daunting number when both health concerns and the cost to stay healthy continue to rise.
A lot of people simply can't afford to purchase it. They're not working for employers that offer health insurance coverage. A lot of our small business community finds it difficult to be able to afford coverage.
State Insurance Commissioner Kim Holland says Oklahoma's uninsured numbers rank 5th in the nation, and points out where we rank in other categories only increases the concern of our uninsured status.
Unfortunately, we also rank towards the bottom of the list in terms of our overall health status. We're an unhealthy population. We rank towards the bottom of the list in terms of the performance of our healthcare system statewide. And all of those things have an impact not only on the cost, but the affordability of coverage.
Well, does this also affect maybe our state's economy, bringing in business if we're this low on the uninsured? Is that a concern for businesses coming in?
It affects it in a couple of ways. The cost of health insurance relative to other states certainly can have an impact, and because we have high rates of what we refer to as cost shift, and that's what happens when we have large numbers of people who obtain treatment, perhaps through an emergency room or other mechanism where they're not able to pay any or all of the bill. There's still a cost to those services, and that gets transferred on to those who can pay in higher insurance rates and certainly in higher tax rates as well.
And yet it's here at the emergency room in the hospitals where the uninsured receive the care and the insured receive the bill.
We have a large cadre of nurses and technicians. The technology is extremely expensive. So to be able to afford both capital and operating cost, then the paying patients and their insurance companies, and hence their employers, have to bear that burden.
Stanley Hupfield is the CEO of Integris Health in Oklahoma City and says while all patients will receive care, those without insurance often don't participate in routine checkups and become more vulnerable to health risks.
And so when they come to our doors, we take care of them, no questions asked. But often it's a little bit later in the disease process. They're more advanced, they're more difficult, and probably their health status in general because of their nutrition and other kinds of issues is not as solid.
A trend Hupfield says is growing.
And in the last 10 years, we've gone from about 1/4 of the population uninsured to about 1/3. And I think you can predict that with the high cost of health care, that we may be in a situation that we simply cannot sustain what we've got now.
In 2005, the Oklahoma legislature created the Insure Oklahoma program to help small business owners provide affordable insurance to their employees.
The state has developed a means to provide small employers, right now 50 or fewer employees, with financial assistance to buy insurance from insurance companies in our private marketplace for those employees who currently make less than 200% of the federal poverty limit.
Currently, the state reimburses 60% of the premium, leaving the employer to pay 25% and the employee 15%. The program draws from the state sales tax on tobacco products, and every dollar that is used for Insure Oklahoma is matched by the federal government. Yet this program has gone virtually unnoticed.
There is enough money currently to provide coverage to tens of thousands of people, and we don't have that many enrolled. So we're we being the Oklahoma Insurance Department, in partnership with the Health Care Authority, which is our Medicaid agency, are really working hard to promote the program to the insurance community.
And this sounds like it's a state proactive program, something where you're not relying on the federal government.
That's absolutely right. I mean, we feel strongly that the federal government has an important role to play, but primarily it is to give states the opportunity and hopefully the financing to create their own solutions.
Solutions tailor-made for Oklahoma.
Well, joining me now to tell us more is our Brian Bentley. Well, Brian, how much can an employee actually expect to pay for this type of coverage?
Well, currently they're expected not to pay any more than 15% of the premium, and for, say, a household of 4, their total income, if it were to be $47,000, they would expect to pay roughly around $85.
Well, it sounds like a really good deal. Why are not more employers using this program?
I think it's just the state of mind. A lot of small business employers, they're not thinking about insurance. This program just started in 2005. Word of mouth is getting around. But Commissioner Holland wants to increase the number of employees from 50 to 250, as well as increase the eligibility to get more employers involved.
Now, I think it's something important to mention. It's been said to me many times doing health stories. It's not that we have a lack of health coverage in our state, because we do have the health coverage. We just sometimes don't have affordable health coverage.
Well, like Stan Hupfield said, in America we have such a unique healthcare system, and they'll always take patients in, but typically, like with anything else, someone has to pay for it, and it's either going to be in your taxes or for those of us that are insured.
Well, thank you, Brian. Want to learn more about work going on nationally to solve the insurance gap? I visited with U.S. Senator Tom Coburn about legislation he's sponsoring in our nation's capital. Just head to our website at okhorizon.com and click on Value Added to see more of that.